Well, heartburn has always been a problem. People have had heartburn for years, but in the last 10 to 20 years it's become an even bigger problem. And we don't really know why, but we do know that 60% of patients will have at least some symptoms of heartburn during the year. About 20% of patients, or the population, will have heartburn during the month, and 5 to 10% of the population, or specifically my patients, will have heartburn every day. So heartburn and acid reflux are really a continuum, and of course everybody knows about Tums and Rolaids that can help occasional heartburn, but heartburn that impacts someone's life and or has actual damage to the esophagus or even the upper throat, we call that GERD, or Gastro-Esophageal Reflux Disease. And as patients' suffering increases and or there's actual damage, that's when we start to talk about the possibility of surgery. So surgery also has a scaled approach. We can do some endoscopic therapies for patients where we can go down the esophagus and possibly help the lower esophageal sphincter, which is the barrier between the esophagus and the stomach. More commonly, we see patients with more progressive disease, and there's something known as the Linx procedure, L-I-N-X, and that is a brand new FDA-approved device for the treatment of heartburn and acid reflux. And with this device, we go in and we're able to, in some ways, replace or augment that lower esophageal sphincter. So we've had artificial heart valves around for a while, and now we have an artificial valve or device that can help that lower esophageal sphincter. This is done laparoscopically. It can be done as a day procedure where you come in on the day of surgery and then you're actually able to go home that same day. And this is, we think, going to really help to revolutionize surgery for our heartburn and reflux sufferers. Well, the Linx candidate is someone who has either been told that they need to be on proton pump inhibitor therapy, that's the Nexiums and the Pralosex or Previcids, for the rest of their life. Some of those people are unable to tolerate those medications because of some of their side effects like bloating or headache, nausea or vomiting. There are other folks that just can't afford those drugs because they are rather expensive. There are other people that simply don't want to be on those drugs for the rest of their life. So that would be one type of patient. Another type of patient is someone who is actually having damage to their esophagus despite the fact that they're on these drugs. So you can have burning or esophagitis. That's a common thing that a gastroenterologist might tell you that you have. Or you have Barrett's esophagus, which is what is known as a precancerous condition that could potentially lead to esophageal cancer. So that would be another type of patient who's been on these medications for a long time in many instances, but is still having damage. Another type of patient would be someone who's taking these drugs, but they're continuing to have the symptoms of heartburn. So that burning right behind your breastplate, or they're having regurgitation, which is another common symptom of GERD. So the sensation of things coming all the way up your throat. Lots of people can't sleep well at night, or they get very disruptive sleep, and because they're having bad regurgitation. Some people might still be developing strictures in their esophagus despite these medications, so they're having trouble swallowing. So these would be another potential group of patients that would be a good Linx candidate. We've created a multi-specialty, multidisciplinary heartburn and acid reflux center here at Baylor Scott & White in Round Rock, so that we can bring all the specialties that take care of heartburn and acid reflux, as well as some other esophageal disorders, in one concentrated place. So our patients who come from all over the state, and in some cases from out of state, are able to see all the physicians and specialties that take care of heartburn right here in one specific spot. Well, because it is new and also it should be done by a specialized surgeon, it's only being done in about 60 centers throughout the United States. In fact, I think only 40 of those 60 approved centers are actually doing it. There are several other surgeons in the state of Texas doing it, although I'm the only one in Central Texas performing this procedure at this time, and I've also placed more of these Linx devices than anyone else in the state.